Advocates and people enrolled in the non-citizen healthcare program are raising concerns after changes to the program went into effect in July. We told you back in May the governor made those changes because the cost was coming in over budget. Our state capitol reporter Theodora Coulivaris explains.
Please, Governor, open up the program again.
In Illinois, thousands of people are enrolled in a healthcare program for non-citizens. But in July, the Department of Healthcare and Family Services paused new enrollments for people age 42 to 64. It was one of the changes Governor Pritzker made to the program after costs were expected to come in well over budget. And it's the first time HFS has heard from advocates and people impacted by the changes since they took effect.
These changes will exacerbate existing health disparities in many communities across our state due to untreated conditions, increase in emergency admissions, and lack of preventative care services.
Pritzker also capped enrollment in the program for people 65 and up. Another change would have implemented co-payments for emergency room visits and hospital stays, but that's delayed for now.
The mere fact of having co-payments will deter immigrants from seeking medical care that they need. Therefore, immigrants would be less likely to even seek preventive care, which ultimately drives up the cost of emergency room visits.
Some read comments from people about the impact of these changes.
If it wasn't for medical coverage, I wouldn't be able to have the services and medications that I need every day. I had to decide whether to go to the doctor or pay my bills, since my salary is very, very low. And I had to decide on my health or coverage household expenses.
Reporting in Springfield, I'm Theodora Coulivaris.
This year's budget set aside $550 million for the program. A spokesperson for the governor said, quote, in order to expand the program, the General Assembly would need to appropriate the funding necessary to cover the costs.